It really has been a great year. We've done some restructuring. We've actually been able to bring in a new director for our foundation. We've spent a lot of time focusing on a new strategic plan. So we really want to focus on the whole idea around how we want to raise money so that we're really able to support initiatives that are important to us at the foundation as well as AMDA, and also how we're going to be able to make some of those awards. So we've also developed a proposal committee so individuals, as they feel they may need sources of funding, can certainly approach the foundation. Oh, certainly more important than ever, and certainly a need to try to make it more and more interprofessional. So I think that with the workforce shortage, what we're seeing is the need to have more individuals who are trained in the post-acute and long-term care space and really understand what practicing in that space means. We have an aging population, all the usual things we know about the changing demographics. But certainly what we were through in the last couple of years with the COVID pandemic, I think has taught us more than ever how important it is to have quality trained practitioners in this setting, and the Futures program is a good start for many. Well, yeah, certainly, we're looking to support not just initiatives that are important to AMDA, but initiatives that are important to all of us who practice this space. Many of us who have background in geriatrics and caring for seniors realize the importance of, if you will, polypharmacy. So although we call it the drive to deprescribe here at AMDA, it really is providing support for trying to educate people as how to appropriately prescribe and how to manage and monitor medications in this setting. Regarding the app, it was kind of a no-brainer. I mean, we're here in 2022 now. We need to kind of get with it, and everybody walks around with their cell phones. So certainly trying to bring us up to age and get AMDA started with the app. We were very pleased to be able to do that. 'Why do you make donations for anything? I think one of the things that's very important is it's a way to show how you can give back. For me, it's giving back to an organization that's done so much to help me professionally. I think many of our members and non-members should certainly realize, particularly over the last 2 years, how invaluable this organization was, whether it was through being able to network with colleagues when we had individuals we needed to talk to, utilizing resources that we made free and available. And again, all of those things come with a price. The foundation also helps support some of those initiatives because we realized it was important that they be made available to the general public. And to, again, members and non-members, but that AMDA certainly needed to have some resources to be able to do that. In 2022, what we're looking for in the future is raising more money. We have an industry advisory board. We're certainly looking to expand that. We've worked with a number of pharmaceutical companies, but we'd like to look at working with other types of companies that also may have an interest and a shared vision in what we do. When we look to those individuals, it's not just about their products, but it's about they also being vested in the importance of a well-trained geriatric or well-trained workforce. And that's something that their donations and their contributions through the IAB actually help us do as the foundation. So I think that's one thing. We have our strategic plan. We've done some restructuring and reorganization in terms of our campaigns. You'll hear more about our annual campaign and our efforts to keep reminding you how important it is to give. We'd like you to give on a monthly basis. We'd like you to give on an annual basis. We'd like you to consider planned giving. As many of us are getting older, we're thinking more about estate planning. In addition, other opportunities. As people get older, they start having to take retirement distributions, and sometimes it's an advantage to be able to use those for a good cause. And we'd like to be on the list of good causes for all of our members. No, just want to thank everyone. Want to thank all of the AMDA members and beyond, everyone who's practiced in this space. It's been a difficult couple of years. I also want to particularly thank all of our donors and all of our future donors, which I hope will be everybody who's a member of AMDA and everyone who touches AMDA in so many different ways.